Hi, this is Dr. Cordy. I'd like to talk a little bit today about how we diagnose polycystic ovarian syndrome, or PCOS. PCOS is a condition that we can diagnose if there are 2 out of the 3 criteria met in a criteria system called the Rotterdam criteria. And the first condition or criteria is an ovulation problem. And there's basically 2 different things that can be problematic. One is called an anovulatory cycle, which is basically you're not ovulating at all. And the second one is called an oligo-ovulatory cycle, which means your ovulation is unpredictable or it's irregular. And so that tends to present itself in symptoms like really long periods or really long PMS times before your period. And the ovulation time is unpredictable. So if you're trying to get pregnant, it's difficult to know when you're ovulating to actually try to get pregnant. The second criteria is called hyperandrogenism, which means that you have too much DHEA, too much testosterone, and or too much androstenedione on board. That's diagnosed by a lab test or a blood test. And when you have too many of those things, you can have a male pattern hair loss. So your hair loss on the top of your head or even on the sides of your head like this can start to happen. You can get hair growth on your face. The middle of your chest or the middle of your belly is the most common for kind of body hair growth. And then you can also have a propensity to more acne when you have too many androgen. And then the third criteria is actually having polycystic ovaries. When we look at them on an ultrasound, you have too many lumps and bumps on the ovaries, and the follicles that are produced on a regular basis every month simply aren't going away, and you're getting sort of more and more of them over time. It's normal for follicles to be produced, and it's normal for 5, 10, 15 of them to be produced on a monthly basis, but it's also normal for them to go away. And once one mature egg is released, the others essentially are healthy if they dissolve and go away. That's not happening in PCOS. And so when we look at them on ultrasound, we see lots of lumps and bumps, we see lots of follicles, and that's a problem. Even though that's one of the 3 criteria of the 2 out of 3 necessary to be diagnosed with PCOS, it's not 100% necessary to have lumpy bumpy polycystic ovaries to have polycystic ovarian syndrome. You can have the other 2 criteria met without having to have the polycystic ovaries. There's so many symptoms involved with PCOS that it gets really complicated. And we have to have some criteria to be able to say yes or no, you officially have or officially don't have PCOS. And it's nice to be able to do this because there are so many symptoms that overlap with other problems like hypothyroidism, like digestive problems, like mold toxicity, like parasite problems. And so when we can look at this category or this criteria of 3 different things, and if you have 2 of those, we can officially say you have PCOS, it's helpful for us then to start helping you get better because we know how significant or serious the symptoms you have are, and we have something to work with and to start with. Hopefully this helps, and we'll continue to break down other information with PCOS on a day-by-day basis or a video-by-video basis to help you understand a little bit better about how PCOS shows up, how symptoms show up with it, what they're coming from, and how we handle them naturally in this practice. Thank you.